All right, joining us via Skype from the city of Bobo Dioulasso, Burkina Faso, is the Director General, West Africa Health Organization, WAHO, Professor Stanley OKOLO. Good morning, Professor. Thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
All right, so some cheering news for Lagos State is the fact that it's only the index case that has been confirmed to have the virus. But there is a challenge, and it's causing some sort of worry for Lagosians or perhaps Nigerians. The fact that there is a challenge with tracing other passengers that were in the flight with the index case. How much of a challenge is this, seeing that the focus now is on containment?
It's always a challenge for us when we have somebody who was not picked up at the airport. As you know, the history of this Italian man, he had no symptoms, his temperature was normal, and therefore he came through. But the processes that are in place and the expertise that the Nigerian Center for Disease Control and, of course, the Lagos State Emergency Operations Center, the focuses and the processes they have in place is such that it makes us confident that this painstaking process of contact tracing is really going in the right direction. Of course, there is also equally the advice that we always give to the public. If you think you may have been in contact with this man, the best thing for you would be to at least self-isolate and report to the health authorities, to the health personnel, because there are free phone numbers that are available for you in Nigeria.
All right, Professor, there has been talk about the weak health systems in sub-Saharan African countries, and Senegal just witnessed or just recorded its first case of the coronavirus. How troubling is it for you and your organization that this could spread, also considering the weak health system in the countries?
We are always on alert, and that is why we have a lot of these public health institutions in each of the countries. Of course, the challenge with the weak health system that you talk about is the challenge of infrastructure, the challenge of transport, for example, the challenge of having similar infrastructure as we have in the urban areas, also in the rural areas, which we don't necessarily have. Yes, we do have that, but we are, at the moment, we are confidently ready that once some of these cases are picked up, we can immediately contact trace and contain them. As you say, we are on containment. The chap in Lagos is under isolation, quarantine, being looked after, and I understand that he is medically stable, does not have severe disease. The one in Senegal, who came in from France, is also under isolation, being looked after. There are also, of course, constantly suspected cases on which tests are being done, and therefore I would expect that you may find that we'll have more cases as the weeks go by. We have always said, from the first interview I did with you sometime last week, before we had the first case in Nigeria, that it's not a matter of if, it's a matter of when. And that's why we had all this preparedness. But at the moment, we are concerned about if this was a large epidemic in West Africa, if we had to stay in for the long run, we need to make sure we stock up on the contingency stock, on the laboratory reagents, on the personal protection equipment. And I see that WHO is also engaging the global health security supply chain in order to ensure that countries are supported in this.
Looking at regional collaboration, regional effort to tackle this challenge. Is that what we are looking at, seeing that, like my colleague has rightly pointed out, a case being seen in Senegal and we having weak health systems?
Yes, you're absolutely correct. One of the things that is fortuitous is that the two countries in our West Africa that this has happened are countries that have already significantly strong health systems. So Senegal, Nigeria, and we do know that we also have such in most of our countries. However, there hasn't yet been the need for WAHO, West Africa Health Organization, to deploy its rapid response team to any of these two countries because at the moment they are consuming their own steam.
All right, Professor, before we let you go, there are claims of breakthroughs in finding vaccines or cure for coronavirus. We've had 2 cases from Nigeria already involving one of Professor Maurice Yu. We'll also get some reports from Israel. How much, at least from the West African region, how much of effort is put into ensuring that they assist in passing through this breakthroughs through the right protocols to see how they can be used or deployed as the need may be?
I'm sure you know that the framework that is available globally in terms of particularly such global emergencies is that the WHO framework for registering either vaccines or treatment is usually cut short so that we bring such discoveries quick to the market and available for patients to use. Therefore, it's not necessarily a regional thing, it is a global thing. And the moment it is certified by the international community and international scientific committee of the WHO, you will find that within days, not a matter of months, it is available for us to use.
All right, talk to us quickly about the fact that there's been a lot of panic amongst persons with regards to this, especially with regards to protection. Do they stay protected or preventing a spread of the virus? By way of educating people, talk to us about this.
The first thing to say is that this virus is, for the most people, a mild virus. There are people who are particularly high risk. So the older people, the people who have their immune responses depressed, or people who may have HIV, or people who may have other comorbidities. Now, so that is the first thing to say. The second thing to say is that the virus is spread by droplets, and therefore the personal protection practices that we have been hammering on is what people should actually do. And if they do that, there's no reason to panic. So wash your hands thoroughly with soap and water. Do not touch your face and mouth without washing your hands. If you haven't got water, use alcohol sanitizers. Avoid people who have either cough or high fever, or people who have some of the symptoms of the illness. If you have a relation that has that, please make sure that they immediately report to the healthcare people. Use the free phone number. They will get tested. And as you can see, we have had so many people being tested and so many people being negative, even in the region. And so far, only 2 cases have tested positive.
All right, Professor Stanley OKOLO, Director General, West Africa Health Organization, WAHO, thank you for speaking with us.